Hello, my name is Barb Miller. I would like to speak with you today about the nursing image, past and present. Let's start with the past. Nursing has been called the oldest of arts and the youngest of professions. The word nurse is derived from the Latin word nutrire, which means to nourish. In the early 18th century, religious nurses were portrayed as angels. However, non-religious nurses were thought to be disrespectable. In 1840, Charles Dickens portrayed nurses as cruel and often intoxicated in his book Martin Chuzzlewit's. These examples of tarnished views of the nursing profession led to the downfall of the image of nurses. It took many years and challenges to overcome and make nursing viewed as a respectable profession. In 1775, nurses began taking care of patients in the U.S. Army during the Revolutionary War. Florence Nightingale first became visible during the Crimean War in 1853. Linda Richards was the first professionally trained nurse and was the first to establish nursing schools in the United States. In the early 1900s, nursing schools became affiliated with hospitals. However, nurses were still viewed as cheap labor. The nursing profession continued to grow, and by 1944, the first baccalaureate in nursing was created in Virginia. In 1979, the first nursing doctorate was established. Understanding the historical part of nursing will always be important to the future of nursing. Nursing image is affected by the media. What the public sees and hears affects how they think and inevitably what they feel. Some images can be viewed as negative, especially what is seen on television. TV sitcoms and movies often fail to portray nurses in a positive light. Many times nurses appear uneducated, invisible, or under a doctor's rule. Nurses have also been portrayed as sexy or as a battle axe. Who can ever forget Nurse Ratched in One Flew Over the Cuckoo's Nest? At times, mass media ignores or trivializes what the nursing profession has accomplished. Negative images of TV nurses can affect real-life nurses. Newspaper headlines at times may distort or sully the image of nurses. Hard headlines tell stories about how many patients die due to the mistake of nurses. However, many stories don't reflect the whole truth. Finally, there have been positive changes. The Center for Nurse Advocacy began to focus on improving the portrayal of nurses in the media. The center began a series of annual Golden Lamp Awards for the best and worst depiction of nurses. The center developed letter writing campaigns to target producers of shows that don't show nursing in a positive light. In 2006, after 5 months of efforts, the center persuaded Coors Brewery to stop using naughty nurse imagery in its ads. On the other hand, TV news stories can positively influence how the public views nurses. News stories that show nurses helping in disasters or nurses getting involved in hot topic areas, for example, patient safety. When nurses are positively promoted, there is a positive effect on people's perception of the nursing profession. Webster's dictionary defines image as character projected by someone or something to the public. Nurses can improve their image one nurse at a time by playing the leading role in promoting their image by using the power they have. In order to do this, nurses must believe in their profession by projecting a professional image at all times. Nurses have the opportunity to build their public image daily by professional interactions with patients, families, and colleagues. Nurses reflect a positive image by helping other nurses to share their expertise by creating poster presentations for conferences or by writing articles for publication. In 2009, President Obama declared that nurses are the backbone of the healthcare system. In 2010, the American public identified nursing as the profession it most trusts. Finally, many hospitals and nursing facilities are opting for more professional attire for the nursing staff, so nurses can easily be identified as a nurse. Cartoon characters on scrub tops seem to be going by the wayside because they can promote a non-professional image. When nurses speak out publicly on healthcare matters, this shows the public that nurses are educated, responsible, and committed to their profession. The nursing community is making a concerted effort to create a positive image for nurses. Recently, Johnson & Johnson spent $20 million on advertisements depicting ethnic and gender diversity in nursing by simply stating, "I am a nurse." There are also simple ways to improve the image of nursing. Keeping name tags visible, introducing yourself by your full name and title. Provide a good experience for nursing students by taking the time to talk about your role as a nurse and your accomplishments, because nursing students are the future of nursing. Correct inaccurate nursing stereotypes by alerting media sponsors, by writing a letter when nurses or the nursing profession is misrepresented in the media. For years, nurses weren't concerned about the non-positive images of nursing. Most thought they were harmless forms of jest. Now, many nurses are committed to their profession and have begun acting upon these inaccurate portrayals. These nursing actions will help to raise the self-esteem of nursing, of the nursing community, and to help raise the awareness of the dedication of the nursing professional in the eyes of the public. Image is part of the profession. Although nurses have much competence, skill and knowledge are still largely invisible. One way to overcome this is to increase the number of active nursing professionals on a national level. By doing this, nurses will grow professionally. This will communicate and increase positive change to the public. The nursing role has gone through many changes and will continue to change. Nurses have not taken the lead in taking credit for what they do. They often say, "I was just doing my job." As nurses, we need to move away from the virtuous script and towards knowledge-based identity. Nurses need to advertise themselves to become more visible and to show the public the impact they have on healthcare outcomes. One way to help to elevate the image of nurses is when nurses assume more leadership roles and are able to embrace changes to promote healthcare. As a nurse manager, I try to convey to staff about positive image and that they were always a nurse, whether they are in the workplace or not. I use acting as an example. I ask them to always act as like they are on stage. I also use personal examples when appropriate. One example I've begun to use recently, I was in a restaurant with my family when a patron began to choke. I identified myself as a nurse and assisted the person to dislodge the food, aka the Heimlich maneuver. The person asked my name and where I worked. What I didn't realize was another patron overheard me and proceeded to call my place of employment and give them glowing details about the incident. That day, I shed a positive light on my profession and my facility. In conclusion, I would like to add, in my 22 years of nursing, there isn't a day that goes by that I'm not proud to say I am a nurse.